Hi, my beauties. My name is Dr. Stephanie Kappel, and I am a board-certified double fellowship-trained cosmetic dermatologist in Newport Beach, California, and the owner of a boutique skincare line, MDAiRE. And today's video is going to be answering 10 of the most common questions that I've gotten in my videos. I can't always get back to the comments because I'm in my office seeing patients, but I wanted to do a video just addressing 10 questions that might be informative for you guys. So it's going to be a fast-paced day. I'm going to take you along with me throughout the day and answer 10 questions. Okay, guys, just got my kids off to school, and I'm actually going to go to my Pilates class before going into the office to see patients. But wanted to keep this vlog style and the Q&A session going. So my vitamin C, can it oxidize over time? And the answer is yes. So vitamin C is a very heat and temperature labile molecule, but it's actually one of the most impactful active ingredients for the skin, for like melasma, anti-aging, anti-acne, all the things. But L-ascorbic acid is the most important vitamin C derivative to look for in a vitamin C formulation. And a lot of companies will just say L-ascorbic, or they'll have a non-L-ascorbic acid, like a different enantiomer, which in organic chemistry just means a different symbol next to ascorbic acid to trick you guys into thinking that there is L-ascorbic acid in it. But you want to look for L-ascorbic acid. It's the most impactful vitamin C derivative for the skin, but it's the hardest to engineer and formulate. So a lot of vitamin C formulations do not include it. But it can oxidize over time, and that's okay. The efficacy studies, when you're studying it in the lab and looking at histology and skin biopsies with the use of the product to make sure that it's having the impact on the skin that you want it to. Clinically, you can see the improvement. Histologically, you can see the improvement with strengthening of the barrier, increased collagen, increased elastin, all the things. But it can oxidize, but still have this potential in the skin. Usually, like for my skincare line, MDAiRE, it's from production to expiration, it's about 1 year. So even though the color may change, the potency and the efficacy of the molecule does not change. And it may change color, and that's okay. Oxidation is a normal process, and you don't want to stop the oxidation process because then you're going to have chemicals and preservatives and chemicals in it that you don't want to be exposing your skin to. So I think it's really important to not focus on the color change. That might happen, but just look at the shelf date, look at the expiration date, and try to get formulations that do change color, because that means that there's no preservatives or chemicals that you don't want, harmful toxins that are going to preserve the color, but the efficacy of the product is going to remain the same. So why put all these extra chemicals on your face? Also, keeping it cool. You can keep it in a refrigerator because heat, air, water can progress oxidation faster for L-ascorbic acid and vitamin C. So if you want to keep it cool, you can. Try not to store it in like a hot, humid place, like if you live in the tropics or if you live in Hawaii or something like that. Be mindful of that. Other companies, instead of having L-ascorbic acid, they'll just say ascorbic acid, which is not the same, or they'll say R-ascorbic acid, or like a different enantiomer. And then they'll also have like THD and the other forms of vitamin C, which are also okay, but they're not as good as L-ascorbic. My vitamin CFK by MDAiRE has a vitamin C containing blend that has L-ascorbic acid, has THC, and has some of the other vitamin C derivatives, as well as other powerful antioxidants and active ingredients. But THD pound for pound is not as effective as L-ascorbic acid. That's just, based on clinical trials and numerous amounts of data and studies and research. So it's okay, but it's not the best. So look for L-ascorbic acid in your vitamin C, and also make sure it's not in a dropper, because once it's oxidized to the atmosphere, that's, progressing decay and can decrease the efficacy of the product. You want it in an airtight nitrogen-lined chamber to protect the gold, that product that's inside the bottle. Okay, you guys, I'm at work in between patients and wanted to just hammer out through these questions. So the question is, what about Adapalene as a budget-friendly alternative? So usually Adapalene is an alternative to tretinoin, also known as retinoic acid, or retinol. So all vitamin A derivatives we call retinoids, right? And they bind different receptors, but the retinoic acid receptors are intranuclear receptors that actually act as transcription factors, so they alter gene expression. And in English, what that means is these are really powerful actives that can actually change the expression of genes. So collagen synthesis, elastin synthesis, strengthening the barrier, cellular renewal, all the things that we want to have affected in the skin with respect to anti-aging. These powerful actives bind receptors inside the nucleus of the cell, which is like the brain of the skin cells, to activate these different signal transduction cascades or pathways that are going to lead to the results we want: smoother skin, elimination of fine lines or wrinkles, strengthening the barrier, healthier skin. So with that said, there's different classes in the retinoid family. Now, Adapalene, which is sold as Differin, which is over the counter, it actually used to be prescription. This is going to show you how old I am. But back when I was in residency, back in like 2008, when I was at UCLA, Adapalene or Differin was a prescription that we would give to patients with acne. It does have anti-aging properties because it is a vitamin A derivative, although it's really, really good for comedonal acne. So non-inflammatory comedonal acne, like the kind of little hard papules that, adolescents and younger teenagers get. Adapalene was really kind of like our go-to prescription that we would write for that. Several years later, it became over the counter, and it does have anti-aging effects, but it can be, all of these vitamin A derivatives help with acne and help with anti-aging. But Adapalene historically, as far as the research has shown us, is a little bit better for acne, but it still is, potent for anti-aging effects too. So if you're on a budget, Differin or Adapalene is a great alternative to retinol if you want a little bit stronger active for an anti-aging product to use at home. Okay guys, we're just finishing up in clinic, and another insightful question was, what MDAiRE products would be best post-laser procedure? Okay, laser aftercare, MDAiRE recommendations. So the NMF Intense, the NMF Hydrator, both of these are gonna restore the barrier and result in a quicker recovery time. Hey AJ, hey Mary, after laser. So that's what I recommend from the MDAiRE line, because you want a product that's going to restore the barrier, hydrate the skin, reduce the post-laser recovery downtime, and those are devoid of any actives that can potentially be irritating to the skin. Also, I love Elastin Nectar, and immediately post-laser, the Color Science All Calm is a great treatment for immediately after laser recovery when your skin's kind of feeling hot. It has seaweed extracts in it that cool down the temperature of the skin. But that's, the All Calm isn't one that I would use like every day for the week following laser. That would be more NMF Intense, NMF Hydrator, or the Elastin Nectar. Okay, next question. If I'm in my mid-20s and on a budget, what are the product or products you would recommend that I use as I start my skincare journey? So number one, if you are in your 20s, you definitely should be wearing a sunscreen, even on rainy days, all day, every day. I even wore sunscreen at night when I would work out in the gym because of the fluorescent lights, because of the blue light and HEV light emitted from devices that can, break down collagen and cause premature aging. I recommend a sunscreen, and I'm more a proponent of mineral-based sunscreens, but the best sunscreen is the sunscreen that you're going to use. So that's really, really important to use starting in our early 20s, and not only on your face, on your neck, your chest, the backs of your hands, anywhere that there's going to be sun exposure chronically throughout a lifetime, it's really important to wear sunscreen. If I had to pick another one, I would choose a vitamin A derivative, a retinol that you use maybe a couple times a week or maybe every day, or a tretinoin. So you can use, if you want to refer to my video where I talk about the use of a tretinoin, how to incorporate it into your skincare routine, because most people will get turned off by a tretinoin because they use it too much too fast and they have an irritating dermatitis and they don't want to use it anymore. But when you use a very low percent and you use either a sandwich method where you do hydrator or moisturizer, tretinoin, and then you apply a hydrator again, or if you mix a pea-sized amount of the tretinoin with a moisturizer, it will decrease the irritation, but it won't decrease the efficacy of the product. So definitely using a tretinoin. I started in my early 20s. I'm 47 now, and I started, I think, when I was 21 or 22. I actually started earlier for acne reasons when I was a teenager. Thanks, Mom, if you're watching this, because you're the one who got me started on Retin-A Micro back in the day, in the 90s. But it's one of the things that I've used consistently throughout a lifetime, and I feel that after using tretinoin for 20 years, I've really seen the benefits of it. But it can be hard to incorporate into your routine because people will get irritation from it. So using a very low dose, starting once a week, maybe increase it to twice a week after 2 weeks, then 3 times a week after 2 weeks, and starting at like a 0.025, or, not starting out at a 0.05 or a 0.1, and just using it very gradually and over time, it'll really, really pay off. So for my beauties in their early 20s, when you're my age, you'll be very thankful that you started a tret in your 20s. If you can withstand it and if you can build the tolerance to it. But the key is just going low and starting slow. Okay, last but not least, the other component that I would incorporate into my skincare journey, if I was in my early 20s, in addition to a sunscreen and a retinol or tretinoin, I would definitely get an eye serum on board. Your under eye area, if you follow me on Instagram, you know that I'm a huge proponent of under eye skin love, because that is the first to show our age. It's the thinnest skin on our face. It lacks many glandular components that we have in the rest of our face that can kind of help with anti-aging effects. It's the first to show our age because the epidermis is thin, the dermis is thin, And the minute we start to smile, we start to get under eye fine lines and wrinkles early in our 20s because of that collagen and elastin loss. All those extracellular matrix proteins that get diminished, it's the first to show our age in that area. So even when I was like, 21 or 22, I started using an eye serum, and sometimes I couldn't afford eye serums. I literally I was a straight A student, and I'd get scholarship money, and I would get some scholarships, and I'd always use it for my eye serums. No joke. If you knew me in college and med school, you know that that's the truth. I'd get scholarship money, and I'm like, okay, I need to spend a little bit on an eye serum. I got to invest in this. And it was like liquid gold, and I would use it maybe just once a week. But I knew the importance of using an under eye serum. Now, if you can't afford an under eye serum or an eye serum, because most people in our 20s, we can't, myself included, you could just use Aquaphor or Vaseline, just something to hydrate that skin, or just provide some type of occlusive ointment on that area when you go to bed, and just tap, 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 tap. Don't, and just tap, 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 tap. Don't rub it on your under eye skin or do anything too harsh or abrasive. You just want to make sure that that area is covered every night when you go to bed, preferably morning and night, but definitely when you go to bed at night. Hi, my beauties. Okay, so we just finished dinner, homework. The kids are in the shower. I'm about to put them to bed, but I wanted to answer more questions and just knock these questions out. In vlog style is easiest because then I could just bring you guys along with me throughout the random things that I do throughout the day as a dermatologist and a mom. Okay, so the question was, can I use retinol under the eyes? This may vary and differ from other dermatologists who may be giving advice on this topic, but retinol for under the eyes can be tricky, and it has to do with the difference of the histology of the eyelid skin. So spending years looking at the skin under the microscope, I always think about the skin that I'm looking at, whether it's a patient of mine or a product that I'm formulating for my skincare line, and I think of the histology of the skin that we're trying to target. Is it the neck and décolleté? Is it the under eyes? Is it the face? Is it the lips? Because cellular components of the skin vary with location on the face or the head and the neck. So the epidermis and the dermis are very, very thin on the eyes, on the under the eyes, on that eyelid skin. When you look at skin under the microscope, it's a very thin epidermis, a very thin dermis, and it's almost like there's almost no fat, and there's the orbicularis muscle that kind of intercalates into that tissue. So what that means in English is that products that we can typically put on the cheeks or the forehead or the nose, where there's a high density of sebaceous glands, that skin is so thin and delicate, and the glandular components of the skin structures are different under the microscope. Under the eyes, you have meibomian glands and different sebaceous glands than you do in other areas of the face. Like the thickness of the epidermis and dermis are thinner in the eyelid skin. The glandular composition histologically just means when you're looking at under the microscope, is different. So you may get more prone to irritation and almost like a contact irritant dermatitis from retinol under the eyes when you can totally tolerate it on your chin or your cheeks or your forehead. Also, there's a phenomenon called capillary action. So what happens is when you lay down and you put your under eye retinol on, it can migrate to the inside of the eye. Now, if you sleep with your eyes a little bit open, sometimes people do, even it can look scary, but you think your eyes closed. But if you look closely, you look at your husband or wife when they're sleeping, they're kind of open. There could be a little migration, which can cause a corneal abrasion or corneal ulceration as well. I'm not trying to be an ophthalmologist here, but we, as dermatologists, we have to be aware of these risks with periorbital application of topicals. So you have to be really, really careful. If you're using a retinol and you're handling it okay, then that formulation and your skin type may be amenable to that. But for most people, it can cause eye irritation, and also it can cause a lot of irritation under the eyes because that skin is so thin and it's more susceptible to irritation. Now, sometimes you can get post-inflammatory hyperpigmentation because you had irritation from the retinol, and that's what I worry about most with patients. Sometimes patients will come in and they have dark circles under the eyes because not from volume loss or, from increased melanin from just genetic predispositions, but because they've had some irritating under eye serum that they're using and it's causing hyperpigmentation. Sometimes Latisse and eye serums can do that too, or eyelash growth serum, so be careful of that. So also it's important to note that the eyelid skin is different histologically, like I said, under the microscope when you're looking at the cellular composition of that skin, and the active ingredients needed for the eyelid skin may be different than the skin on the face or the neck, the décolleté, the body, and so forth. For example, things that are going to vasoconstrict and to kind of clamp down on vasoconstrict medicine just means vessel, which like the blood vessels. Constrict means to tighten the lumen, the opening of the blood vessel, to kind of shrink down on the blood vessels. Vasoconstricting active ingredients are really important in eye serums because caffeine, niacinamide, green tea polyphenols, these all kind of decrease the vasculature under the skin, which in turn lightens, brightens, and can irradiate the eyes, making them look, brighter, because you're not having that dusky kind of vasoectatic dark circles under the eyes. So you want to look for those types of actives in an eye serum. Also, you want to look for DNA repair enzymes and smart peptides. They're going to upregulate the synthesis of collagen and elastin and all those extracellular matrix proteins that we lose as we gain wisdom and have birthdays. Even starting in our 20s, people will start to lose collagen and elastin. So when they may not have wrinkles when they're at rest, but when they smile and animate, they get wrinkles under the eyes, even in our 20s, because that's when you start to lose collagen and elastin, and you lose 10% each decade. So now that I'm 47, I'm really aware of it. And thank goodness that I did, a bunch of lasers and Fraxels and resurfacing under my eyes. I remember leaving the lecture hall when I heard that lecture when I was, 24 years old. I went right to the laser lab, Beckman Laser Institute at UC Irvine, and I was doing my lasers under my eyes because I wanted to upregulate my collagen synthesis. So when I'm 47, like I am now, it will, it would have kept me ahead of the curve. So, but that's lasers, and that's, resurfacing, which is a whole different YouTube video. But we want to have peptides. You want to have, I'm not a big fan of growth factors or exosomes. I think they're a little bit more, they can have neoplastic potential. And as a, skin cancer surgeon for many years, we'd have to stop peptides and exosomes growth factors, stem cells, exosomes on our patients for possible neoplastic activity. So I'm a much bigger proponent of peptides, like in my ECM eye serum through my skincare line MDAiRE. We have very smart, elegantly engineered and formulated peptides that are going to increase collagen synthesis, increase elastin synthesis. And what that does is it provides that structural support under the skin to smooth and tighten the skin. So those are the kind of active ingredients you want to look for in an eye serum. Yes, you can use retinol, and retinol is amazing for other areas of the face, but I would just proceed with caution if you're using it under your eyes. Now, my ECM eye serum does not contain a retinol for that reason. However, the Eye Bright masks do, and that's different because that's in a hydrocolloid formulation and engineered with other components of it, which helps slow down the vehicle delivery systems and doesn't make it as potent as a retinol delivery system for under the eyes. So if you want to avoid having it in an eye serum, certain eye masks and certain formulations of retinol are safe to use. But I always say just, try things, if you like, with caution and not too much too fast. Start low and go slow and see how you do. But retinol is not usually what I recommend for my patients for the under eyes. Now, I use it all day long everywhere else, but just really proceed with caution when using it for your under eyes. Okay, you guys, I'm down here at the beach at my son's surf practice and wanted to knock out a few more of these questions. So next question, how does Picosure compare to Fraxel Dual for anti-aging effects? So the difference between Picosure and Fraxel Dual for anti-aging effects is determined by the wavelength of the laser. So Picosure, which is actually Pico laser, is manufactured by a company called Cynosure. There's also Pico Way, which is centered on candela. So both of these lasers fire at a picosecond, which is a trillionth of a second, which is a very, very fast pulse width. And what that means is it's great for anti-aging effects. And it's also great for darker skin tones, all the skin tones, Fitzpatrick 4, 5, and 6, because there is no dissipation of heat. It's so fast that there's a photoacoustic, not a photothermal reaction. So it's safe for darker skin types without the risk of hyperpigmentation. Now for anti-aging effects, there is the Pico microfocus array or Pico toning with both of those lasers that have great anti-aging effects, but they are not as good as the Fraxel Dual or Fraxel Restore for anti-aging effects, because Fraxel Dual is a 1927 nanometer and 1550 nanometer handpiece option that targets pigment and also texture. So it helps with pore size, acne scars, fine lines, wrinkles, collagen stimulation, and all the things. The Pico toning and Pico microfocus array with the Pico lasers are great for anti-aging, but they wouldn't be like my go-to. They do have a capability of it, but are not as powerful as the Fraxel, Dual, Fraxel Restore, or like a CO2 or a Halo or, an Erbium laser. But it is really good for hyperpigmentation and melasma, especially safely treating darker skin tones. So think of Pico more for like hyperpigmentation correction and a little bit more aggressive treatment for hyperpigmentation and darker skin tones with a better safety effect profile. And think of Fraxel Dual and Fraxel Restore as more of like an anti-aging laser. So although the Pico has an anti-aging option, it's not as powerful as Fraxel Dual. So to answer the question, Fraxel Dual would be my go-to for anti-aging over Pico. Okay, next question is a good one. Can I take low-dose Accutane for anti-aging benefits, and can I still have lasers on my face? So low-dose Accutane is somewhat of a controversial topic, but it's actually gaining a lot more acceptance now than when I was in residency. So typically Accutane, which is isotretinoin, which is a prescription medication for acne, given in very low doses, like 20 milligrams once a week, 20 milligrams every other week, 20 milligrams once a month, or even more sporadically, can have anti-aging effects by downregulating the sebaceous gland activity and giving that beautiful porcelain-looking skin. A lot of dermatologists, myself included, will take sometimes low-dose Accutane for anti-aging benefits. If you are going to have a laser treatment, a lot of dermatologists or doctors who aren't very well versed with lasers or comfortable with lasers will say their patients cannot be on Accutane while getting lasers. However, those of us who are highly trained or fellowship trained in lasers, we're very comfortable in treating patients with laser who are on low-dose Accutane for anti-aging effects. It all has to do with the endpoints and the settings and understanding the lasers, the wavelength, and different settings that you can adjust to achieve certain endpoints, but they can safely be used in patients on low-dose Accutane. We do it all the time. But again, make sure that you're going to a skilled provider and, minimizing your risk that way, because not everybody is comfortable treating patients on Accutane with lasers, and for a reason. Next question is for Steph, my amazing laser specialist. Okay, so, is there any good laser treatments available for stretch marks?
The answer is yes. We get this question a lot. Oftentimes patients will come in asking what they can do, but I think it's important to know what causes stretch marks first and kind of what they are. So it can happen with, topical use of corticosteroids over periods of time, long periods of time. If the skin stretches quickly and then bounces back, post-pregnancy, gaining weight. But there are things that you can do, and it depends on the stage that the stretch mark is in, or what we call the first stage being the striae rubra, right? So it's going to be a little bit more red and purple. And if that's the case, then the laser that we would choose would be the V-beam laser, so the pulse dye laser. And it's important to know that typically it takes more than one treatment to get full results, and we usually do about a month apart, but it's a fantastic laser. And if we can do that early on to help, like I said, with the redness and the purple. But then obviously as the stretch marks, mature, obviously what causes that stretch mark is just a loss of elastin fibers. So we want to treat the textural issues. And with that, we use the Fraxel laser, the good old Fraxel laser. The Fraxel we can use on so many different parts of the body for so many things, and stretch marks are one of them. And that's fantastic too. So that can help stimulate collagen and elastin within the skin. But again, it can take multiple sessions. So usually anywhere from 1 to 3, if not more, it just depends. And that's what a consultation is for. So we can evaluate and address those concerns that you have.
Okay, the next one's another laser question. Okay, can you compare or explain the difference between halo laser and Fraxel Dual? Halo laser is a mixture of an ablative and non-ablative resurfacing laser. Fraxel Dual, also known as Fraxel Restore, uses 2 dual wavelengths, 1927 nanometers and 1550 nanometers. One targets pigment, one targets texture. Halo, there's also 2 different wavelengths that are used, and one is ablative and one is non-ablative. So they're both great resurfacing lasers. They're both fractionated lasers, meaning they treat a fraction of the skin, so the downtime isn't as bad as like a fully ablative laser. And I would say pound for pound, they're in the same category. They both help resurfacing, stimulating collagen, helps the treatment of like acne scars, textural regularities, shrinking pore size. Also, there's a component that helps with hyperpigmentation and evening out the tone or the melanin distribution. So it makes skin a more even color. So it's good for, melasma or post-inflammatory hyperpigmentation, evening out the texture and the tone of the skin. I personally like Fraxel Dual better because I've worked in multiple offices where we had both lasers, and the Fraxel Dual, between the 2 lasers, both gave great results, but patients were a little bit happier with Fraxel Dual and usually only needed less treatments with the Fraxel Dual when head-to-head comparison of Halo. Now that's my own personal experience as a dermatologist using both lasers and working in a laser institute where we had over 100 lasers and devices. I kind of, before opening my own practice, would compare lasers in the same space or category and see which one gave happier patients, more consistent results, better results. And between the 2, I feel that Fraxel Dual is a more reproducible result Fraxel with better outcomes and happier patients. That's not to say Halo's not great. I love Halo also. I think it's a great laser, but between the two, Fraxel Dual is kind of my preference and my, my favorite. But the Halo laser supposedly has less downtime and is less painful, but I feel like Fraxel Dual with the right settings and appropriate numbing cream that's medical grade, it's a very comfortable treatment, and I wouldn't say that the Halo has less downtime than the Fraxel Dual, even though I think those claims have been made. So I hope that answers your question. Next question, best laser options for treating a dark vermilion border. So for those of you who don't know, little anatomy lesson, the vermilion border is this border where the cutaneous lip meets the mucosal lip, where the line of demarcation where the two colors are, the pink with the skin color. And you have to be really careful with this, you guys, because V-beam laser, which is a laser we typically use to treat redness, if you do a V-beam on the lip, it will permanently bleach or blanch out the lip there. And so you'll have like a white spot or an area where there's no vascular perforation of the lips. So with this comes into being important, like when people have bruising from lip injections and you do a V-beam to treat the bruising, if you treat the lip, it will actually cause like a white mark, which could be permanent on the lips. So you have to be very careful with lasers around lips because you don't want to permanently discolor the lips. If there's hyperpigmentation, meaning increased melanin or like brown discoloration of the vermilion border, there's lots of different lasers we can do. I love a Fraxel 1927 nanometer wavelength handpiece, or a Clear and Brilliant, or there's other lasers that can help with lightening that up. But I definitely would go with a laser that targets pigment, not hemoglobin or blood vessels, because you never want to knock out blood vessels in your lip because that will, cause a permanent like irregularity in the color of the lips. I hope that makes sense. Okay, you guys, thank you for hanging out with me today. Hopefully those were insightful questions and answers to your questions. And thank you so much for coming along for the ride. All right, love you guys. We'll see you next week. Okay, guys, just leaving the office, about to go pick up my kids from school and take my son to surf practice and take my daughter to volleyball practice, go home and make dinner. And my job as a mom starts now. Being a dermatologist is a lot of fun and more predictable than being a mom, but they're both amazing jobs and I love them equally.